Thank you, Jeff. We've heard a lot from all of the presenters today in this session and in other sessions about alignment, trust, communications. We're going to take just a few minutes for questions, and I'm going to tee one up here. For all of the presenters that just presented, if there was one area and one of the other partners that you could really say, this is the question I have that I need to understand better to get better alignment, better communication, better trust. Is there something that really stands out with a specific partner? And we've heard from business, finance, NGOs, multilaterals, bilaterals, financing mechanisms, and NGOs. Is there one that stands out to any of you and would like to really address that issue? How do we build that trust and develop that communication and alignment? And is there one weak link? Is it all of us? Anybody willing to be bold?
So I'll take a shot at it. So as I said at the beginning of ours, I think there are a number of different levels of where the trust issue comes in. One is between sort of the final patients in country and those delivering the care. I think you're talking about it more between the partners, the relationships between the partners. And for us, it isn't, I mean, we don't have interests that aren't aligned with the other players here. So it's not like it's a lack of trust for us, it's a lack of knowledge. And that's why something like this is so valuable to us, because we can learn more about what the companies are thinking about. And we do engage companies regularly, but getting a broader perspective about how the entire global health community is thinking about it is always valuable. And so events like this are very helpful to us. But I wouldn't characterize it as trust. I'd characterize it as just getting information, getting a better understanding of what the company's needs are.
I'll take a quick comment. I think before Ambassador Birx took over the reins, that if there was like a score of, I think, transparency, and I think PEPFAR was like single digits just in terms of that availability of information. And where you see now under the ambassador's leadership is that has gone so way up. So I just give examples. I know, BD is here. I think of SIF, that up front, the joint planning that you have. And again, it's not joint planning that you're sitting here in a conference room in New York, but it's happening in the field where you're inviting your representatives from civil society, from multilaterals, from the advocacy, all the groups there at the onset. But now, again, with our data systems, that we have regular routinized quarterly reviews so that in the field, so that we can actually have open, transparent dialogue about what the issues are. And so that way, this is not a finger-pointing exercise, but the data is there, while it may be imperfect, that we can have open and honest dialogues of where we need to go. Because at the end of the day, it's not about trying to fight about, oh, well, we shouldn't stay at that site because we have so much time there. It's about what's the yield so that we can reach as many children as possible so we can achieve our goals together at the end.
Great, thank you. So you're pointing the finger at yourself in prior years in some ways because you didn't have that data and now you do.
I'd like to say yeah.
Anyone else want to address that? Rich?
Well, I would just say that one of the things that our medical director likes to say is that the essence of innovation really comes out of deep empathy. And so it's that understanding, it's the deep understanding of what are the drivers, motivations, what are the terms, what's the optic? Is it a long term? Is it a shorter term? And a perspective, a driver is what it is. It's not necessarily good or bad, but if you don't have those the ability to see those chips out on the table and to talk about it in an objective way, you're not able to get there.
Yeah. Great. Push the button, the little.
Okay, thank you. Just quickly to add on this. I think that before starting that engagement and perhaps marriage, no, as it was quoted before as a very nice analogy, one of the issues on which, as I said before, we need to kind of find the terms is really innovation. And we're called to reply on innovation proposals, but sometimes we have no clarity on what the real question is. So it's an issue of language, and it's again very important because, for example, countries, and there are very interesting examples in northern countries in Europe, are now engaging very much in facilitating innovation and are asking the UN agencies to be prepared to discuss on that as an innovative and creative way of supporting SDGs. So if a critical and full of opportunities question I see is really innovation. Yeah.
Great, thank you. Thank you. We have time for one more question. So Dick, I think you were first, and we'll...
Well, just a quick question. I realize the focus here has been on public-private partnerships, but perhaps for Kathleen and Paul, or possibly Rich and Stuart as well. Can you make any comment about partnerships with in-country academic institutions and the relevance of those institutions to the partnerships that you've been describing so eloquently?
Okay, so our academic partnerships at the field sites are our most important partners because we cannot go into that setting without having an academic partnership relationship. In particular, the majority of our students are spending their time conducting their observations at teaching hospitals. And so what we aim to do is find academic partners that have a engineering program that they're interested in either starting or continuing to develop, and we work together to make sure that our students can participate in the needs finding activities at the field site, at the teaching hospitals together. And so it's been really important in establishing those partnerships, and some of the most successful ones have been almost going for 10 years to manage expectations. That's been the biggest challenge, managing the expectations of the student participants because they want to go out and change the world, and you have to very carefully manage what they're saying to the various different stakeholders because the most senior clinicians that we deal with understand the long-term investment of working with these students, that they may become medical device leaders in the future with an eye towards those settings and with a background of understanding the unique constraints of those settings. But that information rarely trickles down to the folks the students are interacting with on a day-to-day basis, the nurses, the midwives, the traditional birth attendants. And so they're expecting a product. So we have to work very hard on that aspect. But our partners in country, being the teaching hospitals, are essential. And then we work as much as possible to partner with the appropriate ministries. In most cases, it's Ministry of Health, where they're very much aware of what we're doing and they're excited about it from the capacity building standpoint for their own students.
Is it bidirectional?
It is bidirectional, yeah. And to the extent that the partners want it to be. I mean, some don't want it to be that way, some do want it to be that way. And we try to set things up at the beginning that will work for both parties.
Okay. I'll answer the question in a similar way with a story that we, in the run-up to the London Summit on Family Planning, which happened in 2012, JPIGO made a commitment to investing in postpartum family planning in Burkina Faso. We decided to invest our own resources in addressing major gaps in that country and access to contraception. And as a result, that garnered attention and interest amongst a wide variety of groups, including, of course, the Ministry of Health of Burkina, local universities, medical training colleges, et cetera, and an anonymous foundation who called us, thankfully, out of the blue, and said, "We're really impressed with what you have decided to do? Would you be willing to work with us on an engagement to help improve the quality and accessibility of training for nurse midwives in this country to be able to better insert the full range of family planning methods, right, that were allowed by law in that country. And I think it's just such a great example of how we were able to kind of bring different stakeholders together, put ourselves out on the line a little bit, and how it ultimately, even if we may not have intended for it to happen quite this way, that good risk can produce good returns, and in a way that really helps strengthen the system through those universities.
Thank you.
I was just going to make a quick comment. PEPFAR has made really significant investments over the years, whether it's formal programs like MEPI-NEPI, certainly, and there's a bias, I guess, as it comes to that a precursor statement. What I say doesn't necessarily represent U.S. State Department, is I was a Fogarty Fellow and recognized the really great, tremendous value of working with your fellow med students or engineering students or business students, because that's really where the hubs of innovation are. So, again, and our ambassador has really made some important statements progressively about how the access to the data that we're collecting, how we can have the best and most brilliant minds really helping us look at this as well.
Great, thank you. Thank you. Thank you all. Please, all of you join me in thanking all of the panelists again for these presentations. And I'm now going to turn it back over to Renuka and Joe to close up the day.
So it was a long day, but a great day. I really thank all of you for your attention. The original agenda had Joe and myself wrapping up the day with takeaways, but we've taken a decision to do that first thing tomorrow morning, just given that we've had such a long day and discussions. But a couple of reminders for those who are not coming in tomorrow, please take a moment to fill the evaluation forms. They're outside and also within your folder. Okay, you have them with you. Green sheets, so we would love to get the feedback from all of you who are not coming in tomorrow. Gentle reminder, tomorrow's session starts early, 8:30, and it'll end at 1:30, but we'll start with the wrap-up as well. And I don't know, Joe, if you want to add anything, otherwise there's cocktails waiting for you and an informal networking. So please enjoy the reception.
Let me just add my thanks as well for everybody's attention and really seriously exciting engagement. It's been a really good day. I'm glad we have it all on tape. And we have a lot of ideas for the next session, certainly tomorrow morning, as well as this part 2 of this workshop in October. So thank you very much for